Thank you for tuning in to Module 3's Tool Workshop. Moving forward with our semester-long charge, we will be developing a health reform report card and an intervention design and evaluation framework strategy. We'll start with a health reform report card. To develop this tool, we'll be revisiting our Affordable Care Act case study. Reflecting back on our public health infrastructure map tools, as a healthcare system, what are we ideally aiming to accomplish? And how do we operationalize achieving these aims? As we discussed as part of the ACA and health reform case study, the key principles of the ACA are to protect families' financial health, to make health care coverage affordable, to aim for universality, to provide portability of coverage, to guarantee choice, to invest in prevention and wellness, and to improve patient safety and quality care, and to maintain long-term fiscal sustainability. Which problems of the U.S. health system do these principles target? Reviewing the key elements of the ACA that you consider for the scenarios of the conferencing exercise, we start with a health insurance marketplace and reforms, health insurance exchange, subsidies for premiums, expansion of public programs, the individual mandate, employer requirements and incentives, provisions for small employers, delivery system reforms, and shared responsibility for financing. These elements have led to expanded health coverage access for over 20 million people who were previously uninsured. It was accomplished through multiple strategies, including portability, limiting exclusions, Medicaid expansion, employers and health insurance exchanges, for example. They've also led to clinical preventive exchanges and services included with first dollar coverage, and to establishing the Public Health and Prevention Trust Fund. They've led to loan repayment incentives for public health workers and have led to requiring hospitals to assess community health needs. And so, as a result, as we've already looked at for the case study, you can see the positive impact on healthcare coverage. Another element of our ACA overview to consider is how states implement the ACA. As you see, 16 states and DC run a state-based marketplace, 7 a partnership marketplace, and 27 a federally facilitated marketplace. And take a look at where we are with Medicaid expansion. Moving to our tool, what would you include on a health reform report card? And what grades would you give these ACA provisions? For your tool, create a report card on health reform, including 4 to 6 criteria. In Module 3, we'd begun to think about criteria for measuring health. What criteria do you think are most important to use as a report card when assessing current or future health reform efforts in the U.S.? Which of these principles would you include on a health reform report card? Next module, we'll be focusing on advocacy and returning to a prioritizing minded exercise. You can also think of this report card as priorities for the much needed advocacy that'll surround any repeal process that the ACA may be facing. Maybe this will be an opportunity to improve the measures that are graded poorly. Now we're going to turn to the interventions that keep us healthy. Our next Module 3 tool focuses on intervention and evaluation strategies. Remember the system logic model that served as our second tool? We revisit the health problem analysis and social ecological models, as well as the different health intervention strategies and the various levels of prevention from previous weeks. But we're now honing in on a specified target population to implement and evaluate a health intervention, as exemplified in our HIV/AIDS Health Project in Thailand case study. And to frame our analysis again of a health problem and intervention, we'll start with a reminder of the levels of the ecological model. Moving back to the health problem and understanding where to intervene, let's use neonatal mortality as our example. And we'll begin with low birth weight as a prime determinant. A determinant can be defined as a scientifically established factor that relates directly to the level of the health problem. A health problem, of course, may have a number of determinants identified. What can have an impact on low birth weight? Use of prenatal care is one direct contributing factor. So indirect contributing factors may be daycare, maybe transportation. What else? Here's a worksheet that you can use to analyze a health problem and begin to plan public health intervention. Here's a more detailed analysis of neonatal mortality as our example. Let's now turn to intervention strategy at each of the levels of the ecological model. While the slides don't exactly come out in this movie, they are attached to the tool guideline item, and you'll be able to see this depicted better there. We're looking at intervention at each level of an ecological model. Using this health problem analysis to guide what factors we'll be targeting. And quickly, let's just move to another example that's from my work, focused on the role of school and obesity prevention in children and adolescents, and the varying surrounding levels and intervention described in this model at each of these levels. I'll give you a minute to read through them quickly. And as we learned in Module 1, a logic model is a useful tool to organize an intervention plan, also showing the theory and providing a basis for evaluation by specifying intended outcomes. It's a simple illustration of what you and your organization do, why you do it, what you hope to achieve, and how you'll measure achievement. Evaluation. Logic models illustrate how a project, program, or policy is understood or intended to produce particular results. So we're now ready to develop our tool, an intervention and evaluation strategy framework. You develop as a group, and then you'll also submit this tool individually for a grade. So using a health problem that your group identifies, groups will analyze the problem for its determinants and contributing factors, and then identify various health-related or illness-related interventions that fit these models. Following these tool guidelines are templates for you to use to discuss the draft your tool is going to use as a group, and you can draft your tool as a group. Your final tool then should be submitted formatted using this health problem analysis guide, and then also using a logic model template. So these templates are also attached in an item above the tool guidelines that you can print off and use. If you have any questions, please let me know. But otherwise, good luck developing your tool. Thank you for tuning in.